My name is Gunnar Faust. Today's date is October 15th, 2017, and this is my informative speech, and this is my audience. Kawasaki disease is an inflammatory disease mainly affecting children under the age of 5. The disease has many horrible symptoms such as high fever, bloody lips, and a body rash. According to the U.S. National Library of Medicine, in an article that they published entitled Kawasaki Disease Genetics Home Reference in 2017, for every 10,000 children, one child under the age of 5 is diagnosed with Kawasaki disease every year in the United States. Today I will tell you about the history of KD, an overview of the disease, the symptoms and stages, and the treatment for KD. In 2000, Jane Burns and others published a journal titled Kawasaki Disease, A Brief History. Kawasaki disease was first seen in January of 1967 by Dr. Kawasaki. He was presented with a patient with all the common symptoms of KD, and although it was unknown at the time, he published a report in 1967. He and his colleagues who consulted on the case with him had no idea what the disease actually was or where it was coming from. In 1974, Dr. Kawasaki had seen 50 patients by that time, and he published a journal that consisted of all his findings when he treated the patients. And all the patients had the same exact symptoms, so that's why he published them all together. And the disease then became known as Kawasaki disease, named after him, because he's the one who discovered it. And he never figured out a cause throughout his entire medical career. He had lots of speculations, such as an autoimmune disorder, and an autoimmune disorder is when your body is attacking itself, trying to get the disease or the foreign body out of your body. The Mayo Clinic published an overview of the disease in 2016. KD is an inflammatory disease in the walls of medium-sized arteries, such as the coronary arteries. And the coronary arteries are major vessels contributing to the blood supply of the heart muscle. If the blood supply is ever affected in any way, blood clots will form and can cause a heart attack, and that can lead to possible death. And like I said, there's no known cause of the disease right now. Doctors have to rule out other diseases to diagnose a patient. The diseases they have to compare it against is scarlet fever, toxic shock syndrome, and the measles, and they all have the common signs and symptoms of Kawasaki disease as well. And there are 3 main risk factors to Kawasaki disease. There's age, gender, and ethnicity. Children under 5 are more susceptible to the disease. More specifically, children aged 1 to 2 years old. Boys are more susceptible than girls are, and children of Japanese or Korean descent are actually more susceptible because they have a specific antigen in their blood that children, for example, in the United States do not have. Kawasaki disease has a plethora of symptoms. They are scary to some parents because of how red the child is from the body rash and the red eyes. Some cases are far worse than others, but every case is different. Some patients do not have all the symptoms, and some patients will have all of them. Now, with the symptoms, the Mayo Clinic also published this article consisting of the 3 stages that Kawasaki has. In phase 1, the patient presents with high fever, red eyes, strawberry tongue, swollen hands and feet, swollen lymph nodes, a red body rash, and cracked and bloody lips. So you can see that the child is very, very red. The phase 2 is severe skin peeling. It often comes off in sheets on the hands and feet, vomiting, diarrhea, and abdominal and joint pain, and also irritability. Phase 3 is when the symptoms start to dissipate and go away, and the child may develop cardiac issues during this time if they're left untreated. The treatment an article was published by J.W. Newberger in 2004 titled Diagnosis, Treatment, and Long-Term Management of KD. There are 2 treatments that are used right now for treatment of Kawasaki disease, and there's aspirin, which treats the inflammation and the fever, which aspirin is an over-the-counter blood thinner, and gamma globulin, or also known as IVIG, is a protein given through an IV, which an IV is intravenously through your arm. And that is to reduce the heart problems that come along with Kawasaki disease. Now, aspirin is often given after the symptoms have gone away to prevent clotting. Like I said, it's a blood thinner. And too much aspirin can lead to Reyes syndrome, which is swelling of the liver and the brain. And like I said, the children can develop heart problems throughout the course of the disease, heart problems such as coronary artery aneurysms, which can lead to heart disease or chest pains if the aneurysm were to burst. And there are more treatments for the disease, but the aspirin and IVIG are the most commonly used and the most effective out of all of them. So today I told you about the history of KD, an overview of the disease itself, the signs and symptoms, and the treatment for the disease. And the Kawasaki Disease Foundation published an article titled, "What is Kawasaki Disease?" And a statistic they provided is that 25% of children who go untreated develop coronary artery aneurysms. And my visual aid, I wrote a children's book titled Jake Gets Kawasaki, and it's to raise awareness for the disease and to show children what's happening to them while they have the disease. Jake wakes up one morning and notices that something isn't right about him, so follow Jake on his journey and learn about his unknown condition. And here is my audience.